I says, listening and reading is quite hard. Listening is fast and reading is tricky. How to get a B? Do we have to enroll in OET preparation? Obviously, as someone who used to be a teacher and used to teach preparation classes, I can see huge benefits in enrolling in preparation classes, and particularly for candidates who are saying, I'm finding particular parts of the skill difficult. By going to a preparation course, the benefits are obvious, that you're going to be learning tips and strategies for these different skills that you're not learning or experiencing on your own. But also you have that feedback option. You know, if you find something difficult, you can speak to the teacher after class or after the online session and say, question 4, I found that really difficult for whatever reason. And the teacher can relate to that. They know what question you're talking about, and they can give you some ideas about how to improve for the next time. So if you've been studying alone for a little while and you feel like you're not making much improvement by yourself, then I would definitely contact one of our premium preparation course providers who are very experienced. They've completed a training course with us, and we feel confident that they can make the difference from a candidate who is preparing by themselves and still struggling with parts of the test. Farazdak says, if I just use simple in writing and avoid complex sentences, is that decreasing my marks? So obviously the level of English that you are producing to get an OET B grade is high. You know, the regulators are requiring a high level of English to feel comfortable and confident that you are going to be able to perform that job role effectively in their workplace. And to have that degree of English is going to require more than simple sentences. It's not really a case here of simple but accurate. It's got to be natural kinds of English. And if we're writing, if we're communicating written information, that means being able to use a variety of sentence types, a variety of tenses, a variety of vocabulary, because that is what it means to have a B grade level of writing. And you might have heard me say earlier when I was talking about speaking and there being 2 role plays and trying to use a variety of language between each role play. It's very similar with writing, to be honest. What the assessor is looking for is a variety of English, because that is what you need to demonstrate that high level of written communication, to be able to summarize effectively for the reader the situation, to be able to present information accurately by using the correct tenses and so forth. So obviously some simple sentences will be correct, will be fine. But if you're going to be aiming for the B grades or higher in your writing, naturally you will need to be using some more complex sentences as well. Mariam says, for speaking, if it says you have examined the patient or ordered a test in a previous history but don't have a proper history, in that case, are we supposed to introduce ourselves? Mariam, it's a bit difficult for me to give you a definitive answer. It should be clear from the background information on your task card whether you have met this patient before, and potentially if it says that you have already examined the patient or ordered the test in a previous visit, then that does sound like you've met that person before. And so introducing yourself as if you were new to the patient doesn't seem very appropriate. It could be that you say something like, hello again, just to remind you, my name's Rebecca. Thank you for coming back for your test results, or something like this. It could be an introduction like that, but it should be clear that you recognize this isn't the first time that you've met the patient. Marion says, is it necessary to ask the name in between the role play? So Marion, this is certainly a strategy that we suggest can work quite effectively on test day. Sometimes candidates want to ask the patient's name during the role play time. it is okay, but remember that you only have 5 minutes to try and cover as much of the tasks as you can. And spending time asking the patient's name isn't really demonstrating some of those language requirements that you will need to complete the task. So one of the suggestions we have is in the preparation time for each role play, you can check with the interlocutor what name you should use for them. And then you can start by saying something like, "Hello, Merin, my name's Rebecca. I will be your doctor today." And it just sort of reduces the time it takes to get the conversation started. Harvey says, what are the changes to writing which will be in August? So Harvey, there are no changes to the format or time of the writing test. All that has changed is that the assessment criteria which the assessors use for grading writing have been in a minor way updated. There used to be 5 assessment criteria, and those 5 assessment criteria have essentially been reclassified into 6. We're not asking you to produce anything different to what we have always asked you to do, but we have found a way to more clearly express those criteria so that when you're preparing for the test and on test day, you have a much better understanding of what it is the assessors are looking for. I posted a link to the writing page a little bit earlier in the session, but I'm just going to post that link again. It will come up at the bottom of the comments box. So if you're not familiar with what the assessment criteria are, then click on that link after this session and you'll get a clear explanation of what it is the assessors want. Sri Lakshmi says, is it wrong if I write any words with a pen in between letter which I have written with a pencil? Will I be penalised for that? No, there isn't a problem with doing that in the writing test. If when you're proofreading, once you finish writing your letter, you feel like you need to edit it and you're doing that with pen, that isn't a particular problem, no. Maria says, could you tell me how to improve speaking? So Maria, I gave a couple of strategies a little bit earlier in the session. One of them was to imagine that the person that you're talking to in the test is a real patient. I think by putting yourself into your normal shoes of being a healthcare professional, speaking to a patient is really effective at helping you communicate naturally with the patient, because really what the speaking test is doing is trying to mimic real life. These kinds of conversations that you have every day with your patients and talking to them in the way that you would normally talk to them in real life. So by trying to forget that it's a test and instead this is a conversation that you're having with your patient is going to be hopefully a very effective strategy for you. A couple of other things that I can recommend for speaking. Don't focus too much on completing all of the tasks within the 5 minutes. The tasks are there to help you to continue that communication, to continue talking for the whole 5 minutes. But if you haven't finished everything in that time, it won't necessarily reduce your score. What the assessors are looking for is natural communication, a balance of you speaking and providing information to the patient, as well as you listening and responding to what it is that the patient tells you. So those things of listening as well as speaking, responding, reassuring, giving advice, these are the sorts of things that the assessors want to see you doing rather than getting through everything within the 5 minutes. Hend is saying, how can I improve my reading skills? Well, Hen, there isn't any simple solution to that question, but one of the obvious ways of doing it is to read as much as you can. And when I say read, it doesn't need to be test papers. For those candidates who are going to improve reading, you need to just be reading many things and often. So obviously it could be news articles on your phone, it could be a novel, a reading book, it could be a magazine, it could be advertising on your public transport, but just read as much as you can and try to expose yourself to many different kinds of text, some on healthcare, some not on healthcare. Sometimes set yourself a time limit, see how much you can read, let's say in 15 minutes. Other times, try to read for as long as an hour. And by doing all of those different things, reading different types of text, reading quickly, reading slowly, you're going to build up the skills that you need for test day. And then when you next come to do a practice reading test, you should find it easier, for example, to concentrate for a whole hour, because every other day, for example, perhaps you're reading something for an hour long, or when you've only got 15 minutes to answer questions about reading part A, by having read intensively for sections of 15 minutes at a time, that will also help you with that part of the test as well. Deepa Shi says, in emergency situation speaking, how we start question, can we follow the cue card or normal, how can I help you? So in an emergency situation, try to put yourself in the shoes of the patient and imagine what they would prefer you to say if you were coming to speak to them for the first time in an emergency. My recommendation would be that they want to feel like you're going to solve their problem or to help them as quickly as possible. So starting with something like, how can I help you, I don't feel is appropriate in an emergency situation, nor do I feel giving a really long introduction is appropriate in an emergency situation. If I put myself in a patient's shoes in an emergency situation, I really want a healthcare professional coming up to me, perhaps giving me their name, but then explaining what it is that they're going to do to help solve my current healthcare problem. So it could be something like, hello, John, my name's Rebecca. I'm sorry to see that you're in a lot of pain at the moment. I just need to ask you some questions and then we can hopefully get something to help you with that. So you're getting into the conversation quite quickly, you're demonstrating to the patient and obviously to the assessor that you're aware of the emergency situation and you're using language and strategies to sort that situation as quickly as possible. A question about reading, is it okay to give as many answers as we can by using a comma? No, actually, that is a really bad idea, because particularly for reading part A, there is just one answer that would be correct. And if you are giving multiple answers, you will score 0 for that question. So to be really clear, you must choose just the one answer that will be correct for that question. Don't try to write down more than one answer, because you will automatically get 0 for that. Gino says, do we have a minimum word limit for writing? So there's a minimum guided word limit, which is 180 words for the paragraph, so the main body of your letter. If you are to write slightly less than that, as I mentioned earlier, the assessors are not counting how many words you have written. It's not necessarily a big problem. The only problem would be if you've written and you've written less than the word limit, is that you've perhaps omitted something that the reader needs to be able to continue caring for the patient. So essentially, as I touched on earlier, if you have selected all of the relevant information that the reader needs to be able to care for this patient and omitted the information that isn't relevant to this current situation or isn't relevant to this reader, then automatically you should end up with a letter that is about the right length within that guided word limit. So that to me is more of a consideration than going into it thinking, I need to count my words, I need to have this maximum or this minimum limit.